introduce yourselves more thoroughly than I can, because you have a lot of credentials, all three of you. So before you speak, please let the audience know. But yes, Kay, take it away. Thank you.
Thank you. I'm excited to be here. I am a retired union person, spent my life working in the union movement, mostly with healthcare workers and with nurses. And that's how I ran up against our non-functional healthcare system, which didn't treat the workers right at all, nor the patients. And I have now been working for about 30 years on trying to bring national single payer to our country. And I did a lot of work in getting unions to endorse national single payer, HR 676, which was the bill at that time. We got over 600 unions, including, I think it was 44 state AFL-CIO federations in support. So that's some of the work that I'm happy to be doing. But I'm glad to be here and to talk about this really, really important issue, because we have to get it right in order to make it happen. In the time that I've been working on single payer, we've had two go-rounds where it seemed possible that we could get healthcare reform. The first one was in the early 90s, and that was during the Clinton administration. There was a strong single payer movement. We did tours across the country. Here in Louisville, Kentucky, we wrapped red tape around the Humana building and talked about the administrative waste. And we ended up with Hillary Clinton proposing a plan that kept the insurance industry in, turned everything over to HMOs. And we were told at that time that we have to do this because your single payer plan is not feasible, and this one is, and we're going to be able to do it. The reality was that they couldn't even get that to a vote, and that opportunity for healthcare reform slipped away. The second go-round was during the Obama administration in 2009, 2010. And Obama, who had promised in front of the Illinois AFL-CIO that he was supporting single payer, ended up, when he was running for president, not supporting single payer, and indeed supporting a plan in which he included all the insurance industry and all of the pharmaceutical companies, making everybody happy, and bringing us a plan called the Affordable Care Act, which I will refer to as the ACA. Each time we get close to health care, they impose something else in between, and they assert that the plan that they're imposing is going to do exactly what single payer would do, except it's feasible. And I contend that what they impose is always a plan that maintains the profits in healthcare. And indeed, it's the profits in our system, the profits in the insurance industry and the hospitals and nursing homes, the for-profit industry, that makes it not work, that makes it cost so much, and that produces the barriers that keep us from getting to the care. So that's the key thing we have to look at. If there's profit in it, it won't work. If there's profit in it, there will be barriers to care. And that's because there's a basic contradiction between a profit-based system with insurance industry that is, under US law, responsible for producing the biggest profit possible for its stockholders, and the interest of the patients who get denied care because that produces more profit. The insurance companies have put in all of the barriers to care, the co-pays, the deductibles, the pre-authorizations, the narrow networks. You go down the line. Everything in the way of getting care produces additional profit. So it's the profits that have to go. The profits in healthcare are diametrically opposed to the interests of the patients, the interests of the people, the interests of the nation. That's what single payer has to do. Remove the profit-making insurers, the profit-making nursing homes, hospitals, etc. So what we find in addition is that they tell us, well, you can't do single payer, but you can do little tiny steps and somehow we'll get there in the end. We're going to take tiny, tiny steps and we're going to get to single payer. And the problem is none of those tiny steps help us in any way to advance the cause of getting to single payer. You may do something that helps some group of people, but you won't take out the for-profit system that is denying the care to the nation. And there are many of these incremental steps that are proposed. They propose expand Medicaid, patch the Affordable Care Act, improve Medicare by adding glasses, dental, etc. That might be a good thing, but it won't get us closer to single payer. And then there's the proposal for the public option, which everybody was for, and then it went away. But the reality is the public option or a Medicare buy-in doesn't do it for us either, because you will then have a public plan operating in a market-based system. And I think the closest thing that we have for showing what will happen if we do the public option is what we're experiencing now. We have the Medicare Advantage plans that are the private Medicare plans that Joe Namath is selling them. I'm sure you've heard it. And we have traditional Medicare. And we see that this public plan operating alongside of the private plans doesn't fare well. It ought to. Medicare has a 2% overhead, the private plan's at about 15%. But it doesn't do well because there's no such thing as a level playing field. The insurance companies cherry pick. That means they get the healthiest people into their plans. They're more profitable. They lemon drop. They remove the patients who are the sickest and they get thrown back onto the traditional Medicare, and they cheat. They upcode, which means that they pretend patients are sicker than they are. They increase the money that comes to them. We've overpaid Medicare Advantage in the last 12 years by $140 billion. We can't leave them in. The for-profit insurers have to go. We cannot incrementally get to this solution. And I think that the solution that is proposed by many people, we need to deal with as well, and that is that we should do it state by state. That is more difficult, I think, difficult for us to handle, but we need to know the truth about it. So let me lay out the case that those who advocate the state-by-state system make. They say it's too hard to win Medicare for all nationally. So let's do it a little bit at a time. Win one state, then everybody's going to see how well it works, and they're going to want it too. And so there'll be another state and another state. Eventually, we'll have the whole country. The nation will finally see it, and then they point to Canada and say Canada did it in Saskatchewan, in one province, and then others did it, and it became expanded to the whole country. Well, let me just start with Canada. Number one, when Canada did their Medicare for all, they did not have any national healthcare programs. Healthcare was a provincial responsibility. In our country, we have a multitude of national programs already in effect. 60 million are in Medicare, close to 80 million are in Medicaid. There's many millions more in the federal health insurance, in the federal health insurance plans, in others like the Indian Health Service and the VA, etc. So the basic premise of single payer is that you get the funding into one stream, you cut out the profits, you have a public funder, in one stream, you simplify, and therefore you save the money in administrative costs and profits that allows you to use the money to make everybody's health care better and to extend it to those who don't have coverage. Well, if you can't get it into a stream because it's controlled at the federal level and the state doesn't have access to it, you can't do it in the state. And that's the problem. You can't get Medicare money into the state. There's no such thing. I mean, the people say, well, we'll just get a waiver. Well, there is a waiver that people can get for the money that's in the Affordable Care Act. That can go to the state. It's a section of the law that says that. But there's nothing that gives Medicare money to the state. And it's a problem that we shouldn't try to solve by busting up Medicare and turning it over to the states. So that's one of the big problems. That's why many of the people who advocate actually for state plans still say they can do quasi-single payer, or they put single payer in quotes. This is a pathway to single payer. Because the reality is, and many people working on it don't know, that you can't do bona fide single payer in one state. You can't get the funding into one stream. There are other problems that are involved as well. Another one is something called ERISA. And without getting into the woods on that, it's a federal law that says the Congress, the national government, has a right to make the laws that govern employer benefits and employer health care, et cetera. And states can't make laws about that. So those laws basically are blocking the ability of a state to control what employers do, even to tax in a way that they might be able to raise the money. So ERISA is a huge problem, in addition to the Medicare problem, for you to try to do a state plan. And then I think we should also look at what happens if the money gets allocated to the states, and if we could do it one state at a time. And let me just take you through what's happened with workers' compensation, which I'm familiar with because I've dealt with it over and over. The taxing system is different state to state. Workers' comp, while it's a federal, the states determine the taxing. And that has led us for states to fight each other over who's going to get employers to locate in their state. In trying to attract jobs, one state after another says, well, we have to lower the workers' comp because the tax rate's too high, and we get into a race to the bottom because we're in a fight because the rates are different in different states. I think if you look at not only workers' comp, but we can look at a couple of other things that are really, really important that we can't leave to the states. Look at voting rights. It doesn't help us to get voting rights in Illinois if you can't get voting rights in Georgia. It doesn't do it. You have to legislate that on a national scale to actually make it just. And we can also look at reproductive freedom. You know, we're now going through a situation where the right to get an abortion is threatened throughout many, many, many states, and state by state can't fix it. We have to fix it nationally. We need national legislation that's going to put that in place, and that's what we need for healthcare as well. We, in many ways, kind of a states' rights plan is a backward plan, and it's always played that role within our country. So it's not good to divert federal money to the states, and it's not good to break up Medicare. And I think that one of the biggest difficulties is that states, in trying to do single payer, and I don't doubt the good intentions of many of my friends who are working on those state plans. But the problem is, because the barriers are greater on the state level than they are on the national level, they are likely to lend credence to the assertion that single payer doesn't work, because in fact it doesn't work state by state, and it doesn't work in one state. And I think there's one more thing, and that others will talk about. The funding is more difficult. States have regulations that they have to balance their budgets, and you have to balance the budget. You're going to have healthcare fighting against education and a lot of other problems with being able to fund it on a state basis. So what I would encourage people to do is come together and talk about how we can do it on a national basis. And because, you see, some people have gone so far as to say, well, we should drop it nationally. It's not going to happen nationally until you get several states. And that sets up a precondition that we can't accomplish, and that means we never get there. So I think we can say, yes, it's difficult to do this on a national basis. Nobody's saying that this is easy, but it's much easier if we could get everybody in line and working on it and continuing to press for it and building the support. We indeed have majority opinion within our country, which many people have been working on for years. There's majority support for this idea. We have to help the people to understand that the profits have to be removed, that we can't make a compromise on leaving the insurance industry in. That will destroy our ability to get it done. And I think we recognize that we pay more than double per capita what other nations spend, and we're not getting our money's worth. We are 4 years behind in life expectancy. We've suffered more than other nations through this pandemic, and it really is the time to rally our people around getting a bold and beautiful plan that combines what we know in terms of the data and the research with a movement that is strong enough to make it happen. They'll try to impose in front of us an insurance-based plan, but we'll be ready for them, and we'll have the experience and the understanding to make it happen.
You are so right. Everything co-sign. I just want to say it's so incredible that, some of our panelists Friday night and you and so many others, you have been doing this for 3 decades. Like, I am not ashamed to admit I got my free education in 2015 with Bernie Sanders, as many of us did. Like, it took me till my late 30s to realize just how bad this is. So props to you. And you have touched on something so important, that if you take, women's rights state by state, if you take, even civil rights state by state, if you take Green New Deal state by state, this is incrementalism. That's what this is, and it doesn't help everyone. And you are so right. You nailed it.